So I'd like to call the meeting to order. As has been our practice, I'm going to read the roll. Lorna,
Here.
Jennifer,
Here.
Jamie,
Here.
Bill,
Here.
Lou, not here yet. Anita, not here yet. Tanner
Here.
and Jonah.
Present.
Okay, thank you very much. If we could say the Pledge of Allegiance, be the way to start. I pledge allegiance to the
To
flag
the flag of the United States of America and to the republic
for
which it stands, one nation,
under
under
God,
God,
indivisible,
with liberty
and justice.
and justice for all.
for all.
Here we go.
Okay, good job. Thank you. It is a little bit more poignant tonight than perhaps it's been in the past, but I do have a couple of comments. First, I'd like to welcome Jamie to her first meeting. This is not a regular meeting, so we're not going to do the full introduction with the marching band and the streamers. We'll save that until the 25th. But welcome, Jamie. We're pleased to have you join us. I do want to make just a couple of comments about the events of yesterday down in Washington, which were both quite remarkable and certainly extremely disturbing, I think, for all of us. And I think I can say that without having to be concerned about which side of the political spectrum you're on. I think what's equally concerning to me for sure is we don't know if that's the beginning of something or the end of something. We have a ways to go with this, perhaps. And obviously, even though we're removed from those events geographically and in many ways, there's a lot of work for us to do in the schools with understanding and explaining and what happened to our students. I mean, we are an educational institution for sure, and that becomes the goal. I was very pleased to, and I hope board members had an opportunity to see it. Katie and Patrick had sent out a communication which has gone out to our community, talking about these issues and giving some discussion points and some guidance. And I'm very pleased, certainly very pleased, and it's very timely, and I'm glad it went out. We are a community up here. We'll deal with this, but it's gonna take some time for sure. It's interesting. One effect of COVID is I exchange messages, emails, and text messages with my family first thing in the morning. They're all from out of state, and as I was kind of rambling on about the events of yesterday with my family, my daughter offered only one bit of advice, and I mean, obviously we can only do what we can control, and her bit of advice was just to do good. And I hope that's what we're doing here, and that's reflective of the contribution that we make to this community to try to heal those wounds that were opened up so vividly yesterday. Okay, so those are my comments. We do on the agenda, item 4 is public comment, but I checked with um, our tech guys, and no comments. No one has asked to address the board, so there are no public comments. I do see we have some folks that have joined us on YouTube, but we don't have any people who wish to address the board. So and I am going to ask that we add one item to the agenda as item 6. I've asked Patrick if he would give us a brief update on the high school project. So that'll be item 6. So moving into the meat of the agenda, the sole item on the agenda, which is the informational session on the district's COVID-19 procedures or protocols. And I'll turn that over to Patrick to do the introductions.
Thanks, Steve. The district just felt it was important and timely to, do a session that's informational and then have questions after each presenter, just to give the board and the public and everybody that's listening just a better idea and understanding of the protocols and procedures that we use related to COVID. So we have, thankfully, we have Dr. Hannah with us, and we have Ricky Waltz, who's the nurse at Fisher Mitchell, and we have Katrina Barter, who's our nurse at Morris High School, joining us. So we will start with, we sent you some reading from the main DOE, and a lot of that is, obviously we follow that. But I think we can add some other things that I think are important as we look to 100%, for pre-K to 5, and then have further discussions later on about other levels. We thought this was a pertinent topic to talk about. So without further ado, I'll let Dr. Hannah start, and she's going to go over more of the community statistics and the different types of testing, and also quarantining procedures. And if she has the information, which I'm not sure she does, but we have asked multiple sources about, the vaccine for educators in the future. We're fortunate that Ricky and Katrina that are on the line tonight actually have received their first vaccine because school nurses were approved to get the go-ahead to have that. But we're asking the question about when the rest of our staff has that opportunity. So Dr. Hannah, you're all set? Thank you again for being with us.
Oh, sure. My pleasure. So I'll just kind of start with community statistics. The CDC did put out new numbers as of today. And, our rates are definitely going up in the state of Maine. They're going up in our county. I definitely see it in the office, though I don't see it happening more frequently in our district than it is happening in any other district around. It just seems like it's just kind of all over the place. We're definitely seeing more cases. For Saginaw County, just pulling off numbers, we had 433 cases as of yesterday, 461 as of today. Positivity rates were updated as of today. So 2 weeks ago, we were at a 4.1% positivity rate for the prior 2 weeks. Now we're at a 5.6. So definitely a change in positivity rates. So, I think it's not surprising given our recent holidays and the bump that you kind of expect to see with people getting together. And, not necessarily having a whole lot of structure in what they're doing. So trying to gather numbers beyond Saginaw County that are more specific for the towns in our RSU1 community is a little trickier. So trying to find numbers for Bath, Pittsburgh, Woolwich. On the main CDC site, those were last updated on December 13th. So I don't really think that they're terribly relevant right now. Those numbers are going to be higher. But as of December 13th, Bath had Pittsburgh 10, Woolwich 9. They didn't have Rouseck, West Bath. They didn't have, some of those other communities listed. But again, that was quite a while ago. That was 3 weeks ago. So that's kind of where we are with statistics. I still feel very fortunate that we are in Maine. Our rates are lower than most of the rest of the nation. We're lucky to be here, but we are definitely having an increase in rates. So Shall I go on to the next topic, or do you want to ask questions about rates first?
Are there any, does anyone have any questions on that information on rates?
I mean, we
Jen?
have about 5 or 6 things for Dr. Hannah, and you know, if everybody's okay with it, we just maybe have her go through her piece and then stop
Okay.
and ask
Okay.
questions before Katrina and Ricky go. But if that
Perfect.
works.
Okay, Jennifer will
Yep.
hold her question. Yep.
Okay, so the next thing I was going to talk about was testing, because this topic has come up a number of times, particularly with our district, because we're requiring people to have a PCR test to be able to come back to school after travel or if they're sick. And I'll outline the reasoning for that. Across Maine, they have rolled out antigen testing, or the rapid testing, which I think is okay in some situations, but not in most situations, particularly as it pertains to pediatrics. So these rapid antigen tests basically detect protein fragments of the COVID-19 virus. And when these tests were rolled out, they were evaluated in a relatively small number of people. And when they did the testing, it was primarily in people above the age of 20. What they found with those tests is that they are most useful in people who have symptoms within the first 5 to 7 days of their illness. The main AAP, or American Academy of Pediatrics, follows an algorithm that is standardized with pretty much what everybody's doing around the country. In that, if you have a rapid antigen test and it's negative, if you have symptoms that are consistent with COVID, you really need to have a PCR test to confirm it, confirm that negative one. And then conversely, if it's a positive rapid antigen test, you still need a PCR test to confirm that. So for our district, we have required just having a PCR test, because ultimately that's what you have to have, whether you're positive or negative, with a rapid test. So there's no point in kind of delaying getting your PCR test. PCR tests detect genetic material. They're far more accurate. So they're very sensitive. So if you get a positive test, it's not likely to be a false positive test. They're specific. Again, not likely. They detect it well, and you're not likely to get false positives. The downside of the PCR test is just the turnaround time. And when people have a test done, we ask them to treat themselves as if they have COVID. So while you're waiting your 24 to 48 hours to get your PCR test back, you really need to be in quarantine as if you have it. And then if you have a negative test, then you can come out of your quarantine. So the PCR tests, again, they're considered the gold standard. Those tests are accurate even if you don't have symptoms. So for people who are asymptomatic infections, they detect it quite well. They detect it earlier in the course of it. So again, that is the reasoning for requiring the PCR test in our district. Okay. And I'll move on, because I know that there are lots of other things that we need to kind of get through.
I guess Dr. Hannah, I was going to say, why don't you finish all your items, and then we'll come back to questions, if that's
perfect. Yeah. So I'm going to move on to the recommendations for quarantine, because this has changed over the last month. So there were 2 different options that were laid out by the national CDC. Maine adopted, a shorter period of time for quarantine, but that was more conservative than like the 7-day option that some other states are following. And I was glad to hear that. So I'll start with what we do, or what the current recommendations are for close contacts. And close contact is defined as being within 6 feet of a person who is positive for COVID-19, and being within 6 feet for 15 minutes or longer. And that's cumulative. So it's not like it has to be like a 15-minute block, or you're with them for 5 minutes and you leave them and come back, for another 5 minutes. It really is cumulative through the day. But if a person is exposed to someone who is positive, they need to quarantine for 10 days from their last exposure. So say a person came in contact with someone on January 15th, they need to quarantine through the 25th. They're released on the 26th. So it's a full 10-day quarantine. And then they need to monitor for symptoms for a full 14 days. So you may be released on day 10, but if you get a stuffy nose on day 11, you need to go get tested and go back into quarantine until you know the results of that. That's a change from before. It used to be a 14-day quarantine without coming out. And they changed it because I think they just had people who were saying, I just can't do 14 days. You are considered infectious 48 hours prior to the development of symptoms. So when we're doing contact tracing, if someone comes down with symptoms and they ultimately test positive, we have to look at the people that they exposed 48 hours prior to their symptom development. And those people also have 10 days of quarantine. I think where this 10-day quarantine gets tricky for families is it can sometimes be a very long quarantine. So if you have, say, a child who is positive and a parent is taking care of them, the parent needs to quarantine with that child through their 10 days, and then the child gets out on day 11, but the parent's quarantine starts on day 11. So they then have 10 days after that. So it can be a long period of time for some families, which has been very challenging. When people are exposed, the recommendations are for them to be tested 5 to 7 days after their exposure. And the goal of that is to catch those people who don't have symptoms, who then test positive. So that's and then, if you, during that period of time, if you get tested on day 5, but you develop symptoms on day 8, you need to go get tested again. So, and going back to testing, I mean, we are very lucky here. We have access to testing that is coming back pretty quickly. So moving on to positive cases, what we do with a positive case, that period of time that they need to isolate. And isolation means really trying to stay away from your family members. If you can stay in a room by yourself, that's isolation. But that is from 10 days from your onset of symptoms or 10 days from your positive test. Out of that, so when you come out at the end of your 10 days, you need to be fever free for at least 24 hours. You also need to have symptoms that are improving. If your symptoms are just as bad as when you started, then you really ought to stay in until you're feeling better. So, okay. So that's positive. I know I'm giving kind of the whirlwind descriptions here. And then travelers, we follow the main CDC guidelines. Right now, if you travel to New Hampshire or Vermont, you do not need to have any additional testing or quarantine. So those are considered safe states where their rates are quite low still. If you travel to any other state or you travel to another country, you need to then either quarantine for 10 days after return or get tested within 72 hours of returning. Even if you test within 72 hours and you're negative, you really need to monitor for your symptoms for the 14 days. So if you get cold symptoms or any sort of respiratory symptoms, then you need to go get tested. Or retested to make sure that it wasn't an issue with, just testing too early in your course of illness. And again, I can't stress this enough. If a person gets tested, they need to quarantine until they get the results. So if you're coming back from a trip to Massachusetts and you go get your test and you're waiting 24 to 48 hours to get your test back, you need to quarantine until you get that test back. You can't come back from Massachusetts, go get your test, and then go do all your other things while you're waiting for it to come back. You really have to quarantine. So, okay. So that's some of the information about the quarantine expectations in the state of Maine as it stands right now. I'll talk a little bit about the vaccine. Yesterday, Dr. Shaw had a discussion about vaccines and kind of where we are. Looking at the website as of today, it looks like they've given a little over 42,000 vaccinations in the state of Maine. And again, we're doing pretty well, in terms of percentage of population. But on his report yesterday, he said that they're only about halfway through Group 1A, which is basically healthcare workers and long-term care facilities. He was asked the question about plans for 1B, which is 75 years of age and up, and then the frontline essential workers. So I think that's teachers, and they hadn't outlined a plan yet. So when they questioned him further, he said a lot of it was because they don't know how much vaccine is going to be distributed to the state of Maine, and it's hard for them to make plans about that until they can get through 1A and then figure out how much vaccine is coming in. I can tell you locally within our hospital, the administration has been working hard to figure out how they are ramping up the number of people that they can vaccinate, because it's not going to be feasible to do like a drive-through clinic like you would do for a flu clinic. You need to have a setup where you can give a vaccine. You need to monitor people for a period of time afterwards before they walk out the door. So they are actively working on that here at Midcoast Hospital to work out all the kinks and figure out how to make that happen. So, okay. So I wish I had more information about when the teachers could get it. I wish it was tomorrow. So.
Well, thank you very much, Dr. Hannah. If you could, maybe we'll get some questions now. Is that
Sure.
all right? Jen, you had your hand up a while ago.
Thank you, Dr. Hannah, once again for your wonderful insight and helping us through this process. You mentioned that the positivity rates are going up, even in our Saginaw County. I've been also seeing that the death rate has been going up, the number of deaths have been going up. Is that anything that's available per county, or is that not available?
So in the county, yes, I actually wrote down, as of yesterday in Saginaw County, we had one death. So, and that hadn't changed today. So it was still at one death. And I don't know the circumstances. I know that was not a pediatric patient. I don't know any other circumstances behind that,
Any other questions? Lorna, or do you have a question?
I do. And thank you, Dr. Hannah, again. Just it's so helpful for you to be here and walk us through this. I am getting stuck, and it's not just tonight. It's where I'm getting stuck again is you explain again that 48-hour prior period for an infectious person. Can you just say that one more time? Because I have just been so stuck on that.
Yeah, I can. Yeah. So the studies are suggesting that 48 hours before a person shows symptoms, they may actually be able to shed virus and transmit COVID-19 to someone else. And that may not be the case for everyone, but that is kind of the what the studies are suggesting, and that's kind of now what we are all assuming. If someone has symptoms on January 15th, we're looking at everybody that they exposed from January 13th on, because that prior 48 hours, they may not have had symptoms yet, but they could have transmit the virus.
Okay. So the letters that we've had that have said where students actually hadn't been at school. So I think the letters say something like other students were not at school during the period of incubation, or this must be what it's talking about.
Right. So the nurses have been amazing, and so they I can't praise them enough. They have been phenomenal. But so what they do is when they are doing their contact tracing, they're asking people, number one, when your symptoms started, but then they're backing up and figuring out who they exposed in that 48 hours prior. So
Okay.
when a lot of the letters have gone out, and kids haven't been in school, so they weren't exposed to anyone even in the 48 hours prior to symptom development.
Okay, that makes sense. And then I have another question on testing. So So my only confusion on the testing still, regardless of our position on the PCR, is some schools are using rapid testing. And so my question is, would at least a positive, and I'm not suggesting we change our policy, but wouldn't a positive rapid at least be able to potentially get a potential positive out of school faster if we were to do that?
Yeah, there has been so much debate. So every 2 weeks, there is a large collaborative meeting among pediatricians across the state, the pediatric infectious disease doctors, and a member of the Maine CDC. And the topic of the rapid testing comes up every single time. And you can imagine you have a lot of people with very strong opinions, but the feedback from the infectious disease doctors almost universally has been, we need to go with PCRs. And so the schools around us, Brunswick, Freeport, Mount Ararat, I believe all of those are still requiring PCR, or at least the last I talked with, the school docs that work with them, that was their recommendations. I know that some of the bigger schools, I don't know if it's in Portland or Lewiston, I know some of the bigger schools are using those. And you're right, there's the potential to get someone out of the school if they test positive. Although if you're getting a test, we're telling them you need to quarantine as if you have it. I guess the difference would be that you would then quarantine a whole class. I do worry a little bit about risks of false positives, and then you're sending a whole group of kids home and then saying, oh, oops, okay, no, that wasn't really the case, and that's hard on families. And then conversely, a negative test, someone gets a false sense of security. Hey, I tested negative. I'm not even going to bother waiting for that PCR, and suddenly they've exposed other people. So it's hard. I know that you guys are getting pushback on this. I know that you are, and you can blame it on me. But this is the safest thing for our kids to really just have a very accurate test, or that's my opinion. So.
Thank you.
Sure.
I have a couple of questions. It seems to me I had read at some point that the PCR or some of the testing might not be as accurate with younger kids, younger children. And is that the case? I mean, we're obviously in the district, we're working hard to try to get our K through 5 kids back. But are the tests, is that issue of accuracy of the tests with younger children real? I mean,
And for PCR, so for PCR 10, you can even do those on babies, and they're very accurate. The antigen test, the rapid test, I think that might be the feedback that you were talking about, because I think so you can have false negatives with that in all age groups, but it wasn't really looked at. Even when they were establishing emergency use authorization for the rapid antigen test, they didn't really look at them under the age of 20. Now they're getting used all over the country more. We're going to get a whole lot more information about them, and they may change the technology so that it's more accurate. So I hope that there's a point where we can use them. I think we're just not there yet. But the PCR testing, even in infancy, it's a good, accurate test.
Yeah. Okay. Yeah. And the question has come up. I know at one point, Jennifer, you raised it, whether doing random testing helps us at all in terms of trying to potentially identify, cases and as Lorna said, get those kids out of school as quickly as possible, or is that still not recommended? I don't think it was something you recommended at the onset, but.
Yeah, so definitely the more testing any community can do, the better off they're going to be. The balance is trying to figure out how do you not overwhelm, how do you not overwhelm the testing capacity so that you can actually test people who are symptomatic or who are contacts. So currently, in Maine, it's not recommended that you do kind of random sampling of testing. So I wish that we had the capacity to do more testing, to have an easy way to do kind of random sampling. It's just not set up that
Okay.
way yet.
Yeah.
Yeah.
Okay.
Yeah.
Okay. Thank you. Any further questions for Dr. Hanna? I think you'll be with us for the rest of the meeting.
Sure. I'm happy to. Yeah.
If questions come up. So,
Okay.
Patrick, I'll pass it back to you.
Yeah, thank you. Next, we have Katrina and Ricky kind of tag teaming and talking about more school-based COVID procedures. So I'll let them.
Hi, good evening. I'm Ricky Walt, and Katrina and I have divided this up, so I am going first. I did want to just say, if you wanted to know what we do when we do have a child who's suspected of being ill, we do get that child out of school ASAP, regardless of testing of any kind. And we do accept a rapid antigen to get the kid out into isolation, and then we require a follow-up PCR. So, and Dr. Hanna has approved that for us. So we're not doing any testing in school, but if a child has a rapid test done, and it tests positive, then that child is excluded from school until the PCR test comes back. So that is how we're handling it in the nurses. And Katrina, I think that's across the board. So we were asked to talk about some of the prevention strategies that we're using in the school, and I'm going to cover the students first, and then Katrina will cover parents and teachers. Can everybody hear me okay?
Yep.
Sorry about the dog. She ripped the cord out of my computer. So some of the things that we're doing at school with students is we're keeping cohorts small, or classroom sizes as small as possible. We don't have mixing of student classes during the day. In most of the schools, there is no mixing of different classes. It does vary across the district, but all schools are trying to keep students in small groups. And that way, if we do have to quarantine a group of students, it's quarantining a small group of students. It's not quarantining a large group of students. At the high school and the middle school, they're divided into cohort A days and cohort B days. And so there would be a little bit more involvement in figuring out who was a close contact at the middle school and high school. But at the elementary level, we are doing a pretty good job of keeping those cohorts very small. Teachers and staff practice the guidelines with the students. They are encouraged to space themselves 3 to 6 feet apart. Classroom setups vary, but we work to keep students at a minimum of 3 feet apart. And if we can get them 6 feet apart, we have them 6 feet apart. And generally, in those classrooms, the students are facing forward and wearing masks. So any kind of respiratory secretions stay with the student. We have throughout the school with reminders on hand washing, distancing, masking. There are dots and markings on the floors in the building to help kids remember how far to stay apart from each other. With eating, we are doing 6 feet apart, facing forward. We try to limit to no talking when masks are off. If they want to chat during their lunchtime, they are asked to finish their meal and then put their masks back on before they do any chatting, only because of respiratory breath, without masks on. We also, schools have separated their classes when they have lunch by at least 14 feet, which is the guideline the state has given us, that we're not mixing classes if we keep classes at least 14 feet apart. And so some schools are able to do that, and we've done that as much as we can. We have provided cloth masks to students. We have been provided some personal protective equipment from the state supply, and so we've distributed that where we can. We also have disposable masks, and we have a lot of mask gadgets so we can help kids keep their masks on. Masking with minimal breaks. When the guidelines changed a little bit in November, December, and they asked us to keep masks on kids as much as possible and on staff. So We started doing that. Masks are off with eating, which is considered a break. And if a student or a group needs an additional break, it is done with the students stationary. So we don't have them running around. They're at least 6 feet apart, and outside is encouraged. Students are wearing masks at recess. While varying from school to school, thought has gone into use of the playgrounds so that we're not having multiple use of playground equipment without the cleaning, keeping groups small, and having zones for classes. So we're not mixing classes. Training was given to students on coronavirus awareness, hand washing, and face coverings, and that was throughout the district. And we've also reviewed that again at Fisher Mitchell that I'm aware of as we get close to going full-time on Monday. We sanitize the desks. The custodians do that every night, and teachers are given sanitizing wipes as well as soap and water and paper towels so that they can do cleaning during the day as they need to. They avoid sharing items when possible, and there is always disinfection and cleaning procedures for those shared items if they do have to use them. We worked with the bus service. Students are masked, 1 per seat, unless they're a family. The bus runs are staggered, so not to pack the buses, and we are encouraging that the windows be open in the front and the back, although in cold weather, that is not always, and the rain is not always possible, but we're trying to get as much airflow through the buses as possible. Everyone is masked on campus, so anyone who comes onto the school grounds must have a mask. We have medical isolation room for when we have 6 students at school and they're waiting to be picked up. Those rooms are ventilated, well ventilated, and it keeps anyone else from being exposed to the student. And the nurses do post-illness assessment on students to ensure that students are well to be in school. And that might be a phone call home the day before the student is supposed to return. Or if we can't get a student, if a parent doesn't return our call, we will meet the child, at least I do, I meet the child outside and ask them questions about their well-being before we let them in school. And that covers it pretty much for students.
Okay, so I'm going to, can you guys hear me okay?
Yep.
Okay, so I'm going to be talking about our prevention strategies when it comes with parents and guardians and the families. As many of you have seen, we have a lot of guidelines out there. One of them is called our illness guidelines, and another is an at-home screening tool that we developed over the summer and was shared with all families. And then we worked on a COVID-19 guidelines handbook that was sent home, and it's on it's on the RSU1 website, and that's been updated and is shared with families. And we always, whenever these are updated, any of these, they're sent back out again with the updates. We continue to communicate with the families when it's getting close to a break or vacation about our travel guidelines. And we do not allow visitors in the schools, which some families that may have been a kind of a difficult change in what we do at schools, but they've been very understanding around that. All of the nurses call home when students are absent, and we make appropriate recommendations after talking with them and talking about maybe what some of their symptoms are and what's going on. We provide our families who may be isolating or quarantining with the community resources that we have available to them. Like if a family, the entire family is home and sick and they aren't able to get out and get diapers or food, we are able to reach out to a bunch of different community resources to help them out. And we ensure that the social, the mental health, safety concerns are being met when making our contacts with the families. And then when it comes to the teachers, all of the preventative measures that Ricky talked about when it comes to our students are in place with our staff as well. We provided all of our staff with PPE, face shields, masks, gloves, disinfecting wipes, dish detergent, paper towels, everything that they would need to keep their classrooms clean and safe. We shared all of the same things with our staff that we shared with the families, the screening tool, the illness guidelines, the handbook. We shared that with everyone prior to the school opening and then let them know when there were updates. School nurses have taken on a new role this year in working with our staff. They come to us a lot with questions and concerns, and we're happy to help them. School nurses helped with the setting up of the rooms and making recommendations for the signage and how to set the hallways up and the bathrooms and all of that to make sure that we were following all of the COVID guidelines. And again, like with the students, we provided training to all of our staff on coronavirus awareness, hand washing, face coverings, stress management, and talked about all of that a lot in faculty meetings, had question and answer sessions, and again, we're available to the staff, the families, and the students during the school days. So, Ricky, you're up.
Okay, status on the compliance of the RSU1 community. The school nurses talked about this, and this is somewhat from our perspective. So we can't be sure about all of this, but we are definite from our perspective that the RSU1 community has worked hard to comply with what we've asked them to do. Parents have been good about keeping their students home when not feeling well and taking the precautions seriously. District-wide, nurses have made over 1,000 phone calls following up, educating, and monitoring potential COVID situations and absences. We have been working diligently to quickly isolate any identified or suspected positive cases and get close contacts into quarantine to prevent any spread. Dr. Hannah has been a wonderful resource and has helped us with many of our COVID situations, as well as helping us put together our guidelines. And most recently, she helped get the school nurses on the list to receive the vaccine, which we're very grateful for. Community organizations have stepped up to help those in need, and we are proud of the work being done in our RSU1 community. With all of this said, our case rate was very low through the fall, and since Thanksgiving, it has been increasing as it has all over the state. We are admittedly tired, and we are asking everyone to remain vigilant. It truly takes the community during this pandemic to keep our schools open. The schools are following the guidelines given to us to keep us safe. RSU1 has made health and safety a priority. Our schools are a safe place at this time. As community transmission spreads, we will see more cases that will ultimately impact our school because of community transmission. So we ask our community to keep wearing masks and following the guidelines we have provided. On RSU1 procedures, I will cover the school-based non-close contact cases, which is sort of what we talked about when there are no quarantining of people at school. When the nurse first hears about a positive case, we do not know if there are any close contacts at school or not. We work with the positive case and the criteria of the Maine CDC to identify the infectious period and when they were last in school. If we determine that they were not in school during their infectious period, there is no need for contact tracing at school. We assist the positive cases to make sure that they can isolate and discuss with them any possible close contacts outside of school to assist with quarantine. While this is not required of the nurses, we have gone and done this to help them because the CDC recently made changes. So they're not following up with all adults. So we've been really trying to help out that way. The district has been reporting these cases out of an abundance of caution and has recently made a change to this procedure to focus on those cases that directly impact the school. If we determine that a student or a staff member was in school during their infectious period and had close contact, then Katrina will explain that process to you.
So if after we review a positive case and it's determined that there are close contacts at school, the nurse notifies the building principal. The nurse and the building principal we talk about, okay, how many close contacts are there? How much help are we going to need in making these phone calls? Because our goal is to personally reach out to every family member of a close contact before a notification is sent out district-wide. We don't ever want anyone hearing about a positive case and there being close contacts and if they are a close contact, without hearing from us first. And when we do talk with the families that are close contacts, part of the phone call is talking about what does it mean to quarantine? How is that going to look? We share the date with them that is currently in place for them to be able to return to school. And we share with them that date may change, but at that moment, that would be their expected return to school date. And we have a script that has been provided to us in helping us make these phone calls. It kind of helps guide us, and that's been provided by the main DOE. So it is the school nurse's responsibility to report the positive cases of our students to main DOE. And we are also responsible for reporting to them the names of the close contacts for contact tracing. So we have tools that we are to use. It's very specific. Once all of the close contacts have been notified, we let the superintendent's office know, and they send out a letter to the RSU1 community notifying that there's a positive case in our school, at one of our schools. And then after that, it doesn't just stop there. The nurses continue to check on the students. We make phone calls every few days, see how they're doing. It's really important that we know if they have developed symptoms and talk to them about the appropriate time for testing. And if they do choose to get testing, to ask them about receiving the results, because that changes those on quarantine. If someone were to become symptomatic or to test positive, it then changes to them having to isolate. And then again, if someone's on quarantine, has a test, comes back positive, then that's another positive case for us to investigate. And so it's very time consuming, but it is something that is really, really important for us to do to keep our kids in school and to keep everybody safe. And Ricky, you're going to talk about sanitation and disinfecting?
Yes. When we talked about this, it was in relationship to a positive case, but we wanted to point out that we think that key is the daily cleaning of the classrooms and the school, and the extra daily surface cleaning, frequent cleaning done by the custodial staff that is taking place. Also what the teachers are doing in between students, if they share students, they're disinfecting shared materials, etc. When a positive case is identified, that area will be disinfected and cleaned before students return to that room. So if how the DOE asks us to quarantine as close contacts is a whole classroom. So the whole classroom would go home. We don't look at the 6 foot. If they were in the classroom all day long, we are sending home the whole classroom, closing that classroom off, and then the custodians will come in and do the thorough cleaning before those students come back. And I also talked to you about the medical isolation room, and that also is deep cleaned after every ill student leaves the room. We try to do it several times if we have more than one student, but we always have a air purifier, and we use the ultraviolet ray light between to help with the disinfection process. So we're trying really hard to cover all the bases. And that's it for us.
Wow. That's a lot. You guys are doing an amazing job, really. And obviously it's much more than putting a Band-Aid on a child's knee. This has really evolved into an incredible process. Are there questions from board members for Ricky and Katrina?
Yeah, this is Lou. I had a question, and I don't know. So I'm assuming most people are getting tested because they have symptoms. But when you're getting other people are getting close contacts, I mean, do we have any idea just how big the asymptomatic could be out there? I mean, that's obviously how a lot of things must be getting spread. But I just wondered if, I'm assuming the majority of people are getting tested because they have symptoms. But just wondered what your experience has been at this point.
I can speak for those cases that I've been working on. I would say that, yes, you are right, that most of the positives are coming back because they become symptomatic. For the high school students, if the test comes back positive and they have not become symptomatic yet, it's usually within just a couple of 3 days and they have some sort of symptom. And I think that's why we do encourage the testing if they're on quarantine, because I mean, I don't know how many times I've heard, and I'm not speaking just for my high school, but just in general. I thought I had strep throat. It's, I have a cold symptoms. Well, when you look at the guidelines and where to look at mild symptoms and high risk symptoms, when somebody says they have cold symptoms, that could be 3 or 4 of the low risk symptoms. It's not just a cold. And so that's why it's really important that we have these guidelines in place and that the families are aware of them. So I really don't have numbers for you, but I can say that for students that have been tested because they are close contact, oftentimes it's just a couple of days later that they become symptomatic. And Dr. Hannah, I don't know if you have anything to add to that.
We're doing a lot of testing. I think most families are pretty open to getting that test 5 to 7 days after the exposure, whether they have symptoms or not. And we've had some cases within our practice where people have tested negative on day 5 and then they develop symptoms a few days later, as Katrina said, and they get tested again and they're positive. And then those who test positive initially without symptoms usually do develop,
We're losing you.
Am I still here now?
Now you are.
We do have some kids who just absolutely have no symptoms whatsoever. But again, that's where that just kind of standard testing 5 to 7 days after your exposure is really important.
And not just assuming that it's a cold.
Right. So you are seeing this difference, the whole spectrum from no symptoms to a lot of symptoms.
We're getting some feedback from someone.
Yeah, we're seeing the whole spectrum of, I'll just tell you what I'm seeing in my office. I see some kids who come in and they have such mild symptoms that if it was any other time, I would say, I'm surprised you came in, and we do the testing and they're positive. And then we have other kids who, I've had some kids who look like they have influenza. They look sick. They've got fevers and they've got cough and you can tell they're achy and they feel uncomfortable. And we test them, but remarkably, they bounce back very quickly. So when you do the follow-up phone calls to check in on them, they're feeling better within a couple of days. So I think we've been lucky. I'm going to knock on wood that kids seem to be.
I think that's one of the. Am I?
Go ahead, Ricky.
I think I'm vibrating, but anyway, I think that that's one of the hardest things for us nurses is that the symptoms vary from none to, full blown. And so we have been, since the cases have been rising in the area, we've been much more cautious about asking if there are any sick people in the home. And maybe Dr. Hannah can talk about this a little, but I have read some where sometimes, it goes from the parents to the kids.
You're on move.
Oh, so we do ask them about whether they're sick at home. Anyone else is sick at home?
looking at infections in kids primarily, and we've talked about it before, you're really looking at transmission from parents to kids, and that's kind of what we're seeing in the office also. It's not so much transmission from child to child happening within a classroom. It's, you know, they have a parent who goes to work and contracts it, they're sick, and then they're around their kids and they spread it that way. So.
Okay, thanks. Lorna, you had questions?
I did. I wanted to know, and you may have said this already, on the close contact. I know there's privacy, very strict privacy laws, but if you have a child who's in class and you hear that mom or dad has been sick, just hear it. Nobody's officially told you. Can you walk me through that again? Is that considered a close? Is that child in the class who has the sick parent considered a close contact?
So first of all, if we hear, like say a teacher calls and says, Joey told us that mom's home and mom is very sick, we will find a way to gather the information. You know, we will call home and we will just be honest with the family. You know, this is what your child is saying, and we just wanted to check in. If a parent at home or a guardian at home has tested positive, then a student that lives in that same home who has had close contact should not be in school. And we would go by the you know, with split families, that can be tricky. So we follow what we talked about earlier about the 2 days prior to becoming symptomatic or having a positive swab. And then we determine if the child can stay at school or not. The child at school at that time would not be considered putting the others in the classroom at risk. Unless, of course, they were symptomatic and they were positive, but we didn't know it at that time. So it's really, there's just a lot of pieces that have to be put together. But we do follow up on anything that is brought to our attention.
Thank you. Thank you so much for all your hard work.
Oh, you're welcome.
Yep. Jen, did you have a question?
Yes, thank you. Could someone just kind of go over the fact of how siblings are handled? If a sibling has been tested positive, then understanding would be child's class would leave school. But would their siblings also, their classes also have to leave school?
It's so you were breaking up a little bit, so I just want to make sure I understand your question. So if you have a positive case in a home and or you find out that a student is positive and they have siblings in other classrooms or other schools, you're wondering what would happen?
Yes.
Okay. So if I had a student at school and I got a phone call and their test results came back positive, then anyone else in that home is going to be considered a close contact. Most likely, again, if it's a split family or a couple of the kids haven't been home for 4 or 5 days for some reason, though we would have a lot of questions to ask, and we would determine as quickly as we could who the close contacts are of that positive case. And if they're in one of our classrooms, we would get them picked up as quickly as we could. Does that answer your question?
Almost. Would we, so if I'm understanding it right, then we wouldn't be asking the students, the siblings, classmates to leave school. We wouldn't consider them as sure they had to leave school.
That's correct.
Because the sibling hadn't tested positive yet.
Exactly.
If the sibling tests positive, then if they have 2 siblings that are positive, then both of those child's classrooms would need to leave school, right?
It depends on if they became symptomatic or they tested positive and the 2-day, going back to 2 days, if they were in the classroom.
Okay, thank you.
You're welcome.
Okay, I just have a question. I mean, when we started out with kids and hybrid or going 100%, there was some concern that although compliance, I'm talking about students at this point, compliance was very good, but the novelty, I think the way it was expressed, the novelty of wearing a mask and social distancing would wear off, and we would see a little bit less, the compliance would drop off to some extent. Students, kids would be a little bit more resistant to hand washing, to wearing masks, to social distancing. You're not finding that to be the case, or are you?
Do you want me to speak, Katrina? I think there probably are some kids that are feeling that way, but the staff has worked so hard to remind them and to keep on them. And as cases have increased recently, maybe in the fall, toward the end of the fall before Thanksgiving, everybody was kind of getting comfortable being at school and our cases were still pretty low. But we've seen that the community has taken this very seriously and the kids take it very seriously and they do what we ask them to do. And so my perspective at my school is that the kids, there may be a few kids that don't want to do it, but they understand the rules. We've explained to them why we're doing it and how it keeps the school safe. And it really is the layering of those mitigation strategies. Maybe they get too close once in a while or, but it really is wearing the masks, socially distancing and washing our hands the majority of the time that is keeping us safe. So I would say they're complying and it's continuing.
That's great. Good.
And I can speak for the high school level. The kids have been amazing. They are doing such a great job. And, and I just remember in the summer and like in the fall, seeing some of my students in town, and you'd see them with their masks down or not, just down here and up, wherever. And now I see them walking together on the sidewalk on the weekends, and they all have their masks on. I think by us putting this into place before it was a mandate, I think that our students have gotten used to it. And I think it's become part of their habits. I don't see the teachers having to remind our students to sanitize when they enter the classroom. They do it automatically. The students are grabbing the spray Dawn dish detergent and the paper towels and wiping down their desks before they leave the room. Again, like what Ricky was saying, there are some that we have to continue to remind, but I think that's kind of the same for any age group. So.
Okay, great. Thanks for that. Jason, you had a comment or?
Yes, thanks, Steve. This is Jason Libby at Woolwich. On behalf of all the administrators, I just want to say thank you to our school nurses. My school nurse, Roberta, and I are in constant communication, weekends, at home at night, during the day, just to keep from March 14th of last year, to navigate every step of the way here, and the countless hours that these people are putting in to keep us safe. And there's not one moment when I ask any of them, and I've worked with Katrina on the committees, that every answer they give me, I know is with keeping us safe is the first foremost thing. So it's as a sounding board to me as the building administrator, as I'm going in and I'm saying, Roberta, I think we're going to try this. Does that kind of pass what you're thinking? And just being together on the same page is just critical to this whole process. So from the bottom of my heart, I just want to thank you to you all, because I know you're doing that in all your buildings and keeping us as a greater community and us as our individual community safe. So thank you very much. That's all I wanted to say.
Okay. Any other questions from board members?
Steve, old man Perkins here.
Sure,
I'm in awe. Our staff, I've always been complimentary of our educational staff, but I've never heard the in-depth work that has been done and continues to be done by our medical staff. And I want to express my gratitude, and I know everybody else on the board does too.
Thanks, Bill.
Thank you.
Yeah, I think that is the case. I mean, we started out on this with the assumption, at that point, that we could make our school environment the safe environment in the community. And from everything that from your efforts, Dr. Hannah, from the efforts of the nursing staff, and the information you put out to the community, I hope we've accomplished that. I mean, we have up to this point, I think we've got a good record, if that's what it's called. And of course, you can't predict what's going to happen tomorrow. But if the successes that we've seen to date, in terms of exercising what control we can over the spread of this disease within the school, if we can keep on the track we are on now, we'll come out at the end of the year in great shape. And it's to your credit, the nurses and Dr. Hannah and your teachers and the community at large. You know, we depend on the parents to pull their weight here, and I know they've done a great job too. So it is a whole community effort. Jennifer, you had a question, comment?
Just a comment is that, and someone on the board usually asks what presentation we have, but at the end someone usually asks, what tools do you need? There's something that you and your colleagues need in terms of resources.
Jennifer, could you go off? Would you get your video off? Maybe you're breaking up a little bit.
How is this? Is this any better?
Yep, it is. Yep.
The question just is, what tools do you need? Is there anything that you need to do to be able to do work safely and effectively?
I just have to say that RSU1 has been great. I mean, we've asked, and they've gotten. We've recommended and they've done it. I'm just very, very proud. It's all very hard work though. It's not, it's very, very hard, and it's very hard on the teachers. They are willing to do it because they do value the health and safety of the children that they take care of. And it's just been it's a hard thing. A pandemic is a hard thing. And, you guys have really supported us. At least that's my personal feeling. Thank you.
Yeah, I agree with Ricky. I mean, I just think that we are on a listserv, and we are part of weekly meetings with other school nurses. And back in late summer, early fall, it was just really nice for us because we had so many positive things to share about our superintendent and Katie, Joseph, and all of our principals and our teachers, and just everything that the support that we had, and the fact that we actually had a school physician. And that is something that not every district has. And so, again, I think that we have what we need right now. But of course, as you probably know, we won't hesitate to ask if there is something that we need. So.
It's good. Good. Thank you. Thank you. Any other questions from the board? I do, thank the three of you for coming on and doing such a good detailed presentation, and again, for all the work you do. So thank you. Thank you all. Okay. If we can move agenda item 6, Patrick, you want to do a quick update on the high school?
Sure. Dr. Hannah, Ricky, Katrina, you guys can sign off now if you'd like. You can stay on for another couple minutes. But again, thank you. I know Jason and everybody else has thanked you, but thank you very much. Appreciate it. New school, just a quick update. Our contractor, Harvey Construction, continues to make steady progress and continue to assure us that the building will be ready for students on February 25th. There have been some delays in certain areas because of a variety of reasons, lack of labor in some cases, delay in some of our supplies because of COVID, but we're working through those. I think we've already told the board and at board meetings before, the auditorium probably at this point will not be complete when we move in on the 25th. So there'll still be people in there working on that. And then, Harvey does realize the sense of urgency, and they're working 7 days a week. And during this final push, there could be a few other areas in the building that are not 100% complete when we move in as well. And we're working through those details, with Harvey as well. So that's just kind of an update. We're meeting on a regular basis, weekly basis, almost daily basis now, the final details. So again, if any board members would like to come up, we're offering tours every Friday, the month of January for the public. And we start those tomorrow. I think we have 3 tours tomorrow. And we'll be offering tours to our district staff, anybody in the district that would like to come up soon as well. So.
Okay, thanks, Patrick. Any quick questions for Patrick on the building? We got to get it done so Tanner can move in at least for a couple of months before he graduates. So, yep, great. Okay, so we're at the point of adjourning. I appreciate again Dr. Hannah and Ricky and Katrina for the presentation. I just want to remind you, we have that January 14th meeting with the ad team. It's going to be at 5 o'clock, and we'll do the meeting remotely in large part because of the number of staff that generally join us. So we felt remote was really the only practical way to do the meeting. I know Jamie's out there somewhere. Jamie, I not quite as familiar with your work schedule, but hopefully 5 o'clock will work for you. You will not be getting any information in advance for that meeting. It's more of a conversation with the individual members of the ad team, where they'll talk through some of their concerns and some of their issues. Katie will take notes and we'll get a detailed summary of their comments. So hopefully everyone can make that January 14th remote meeting. And then our regular meeting will be on the 25th. Okay, if there are no other questions, comments, if not, I'm going to just poll everybody to get a vote on it, or I'll take a motion to adjourn, and then we'll take the vote. Do I have a motion to adjourn?
I'll make a motion to adjourn.
Okay, well, we have a motion by Lorna.
Second.
Second by Jennifer. Let's go through the list. Tanner.
Aye.
Okay. Lou.
Aye.
Anita.
Aye.
Lorna.
Aye.
Jennifer.
Aye.
Jamie.
Aye.
And Jonah.
Aye.
And Bill, are you still with us? Bill might have hung up. Okay. Okay. So all in favor, all support adjourning, which is a good thing. And we'll see you all on the 14th. Okay. Thanks very much, everybody.
Thank you.
Good night.